Welcome to Relationships in Progress with your host, LaShonda Thomas of Lioness Counseling, located at 5601 Bridge Street in Fort Worth, Texas. Also, check me out on my website, www.lionesscounseling.com. If you want any information about me, as I am a licensed marriage and family therapist associate, and any information you would like to find out from me, you can Google me, LaShonda Thomas, or go to my website, lionesscounseling.com. And so today's topic, I want to talk about our relationship with our larger healthcare system. Because on this relationship, in relationships in progress, we talk about all kinds of relationships, sibling relationships, co-working relationships, spousal relationships, all types of relationships. So today, I just want to talk about our relationship with our larger healthcare system. And so I in particular want to discuss this because a lot of times we don't feel like there is a relationship between us and the system. Like we are separate beings and then the system is separate. But we are not separate from the system. And I say this because we all have to operate within the system. If you want health care in the United States, then there are certain policies and procedures that are in place in which you need to do in order to get health care. I know we may not have the best system in the world, but we do have a system. And in today's topic, I want to particularly talk about the state of mental health in America 2018. Now, in this conversation, I'm going to be presenting some stats, and I'm just going to be discussing my overall opinions about some of these stats that have been posted and some current events that may be relating to some of the stats that has been discussed for today. So I'm going to give you some real life information that you can find on the NAMI Association, and that is always your go-to website on anything mental health related because it is heavily research based, and most of the stuff you're going to get there is going to be fact, whereas reading it from other third-party sites may necessarily give you the most correct information, as this is government publications that have been published that are posted onto their websites. So, one of the first key findings that I want to discuss is that 1 in 5 adults have a mental health condition. Do you know that is over 40 million Americans, more than the populations of New York and Florida combined? Yes, 1 in 5. Now, once again, this is diagnosed mental health conditions. So this statistic is still not taking into account all those people who are self-medicating themselves through various substances because they have untreated and undiagnosed mental health issues or ailments that are not being treated as it should be. So this number is still not as high as what is actually being saw and being presented in our larger society of America. So what does that mean when I say 1 in 5 adults have a mental health condition? Anything when I go ADHD is a mental health condition. Yes, falls into a category of more behavioral disorders that begin in infancy and childhood, but it is still a mental health condition. Depression, anxiety, bipolar, OCD, OCPD, all these are just various mental health conditions that we all can be affected with. Of course, this stat is only taken at a snapshot of time. This is not people saying that you had this once upon a time, no longer meet symptoms for that, because that is going to be a way, way, way more complicated research study than anybody wants to do. Of course, there's always going to be some do-getter or some one-upper that is out there conducting that study as we speak. But as of right now, that is the most findings that you're going to see on various websites saying that 1 in 5 adults have a mental health condition. So that means for every 5 people you meet, at least one of them got a diagnosis that they're either taken care of or not taken care of. Doesn't mean they're crazy. Doesn't mean that that's not somebody you should associate yourself with. Let me be clear about that, because sometimes when we find out people have certain mental conditions, we want to put them in the category of crazy and not fully understand them separate from their issue and their ailments. Another stat that we found is that youth mental health is worsening. It's actually getting worse than what it already has been. And it's saying that the rates of youths with severe depression increased from 5.9% in 2012 to 8.2% in 2015. Even with severe depression, 76% of youth are left with no or insufficient treatment. And there's various reasons why they get treated or why they may not get treated, because I've worked in that specifically field for a good couple, let's say last 4 years of my life. In the hospital field, a lot of it is their parents' relationships with the mental health system are not wanting their kids to have a label that they have to be stuck with necessarily for the rest of their life. Or sometimes they just feel like their kids are just doing things for attention, i.e., the best example that most people say is when they have kids that self-engage in acts of self-harm, i.e., cutting, burning, pinching, scratching, any type of thing that fall into that category. Parents feel like they just want some attention. Regardless if you feel like they want attention or not, they do need the attention of somebody, a mental health provider, preferably, because that rates of severe depression in youth are increasing as well. Of course, we can hypothesize there are various factors into why depression is increasing into youth. I just feel like because they're more exposed to technology, the internet, they learn things at an earlier age than what they had to learn back in the day, and having to evolve and change with an ever-changing society at a pace that people my age or older did not have to evolve and grow at such an exponential rate than what these kids have to do now. And then just people in general are not as friendly as what they were growing up in grandma's time or papa's time and parents' time. The people in general are just not the same that they what used to be. So more Americans do have access to services than a lot of other countries. But they don't doesn't mean that they always access those services, but they do have access to services. So that has increased as healthcare reform has reduced the rates of uninsured adults, i.e., the Obamacare Act. So now people are forced, for lack of a better term, to have insurance, but general health insurance does not always cover mental health. Mental health is very different than your primary insurance plan, and every job does it differently. You may have an EAP, employee assistance program, that will pay for so many sessions of mental health treatment. So you always want to make sure to exhaust those free sessions that you have with your EAP provider and then go out and seek your own provider. So the greatest decrease in uninsured adults with mental illnesses was seen in the states that expanded Medicaid. So once the services for Medicaid was expanded, now more providers are in network, and so now more people are being able to go to a therapist and to get these services that they actually need, and actually are able to actually attend those services. But most Americans still lack access to care. 56% of American adults with a mental illness do not receive treatment. Even in Maine, the state with the best access to services and providers, 41.4% of adults with a mental illness do not receive any treatment whatsoever. Now, of course, there's various factors as to why they're not getting treatment, because sometimes they may not have transportation to the treatment. Sometimes it's long wait lists. I know, particularly in the state of Texas, 9 times out of 10, if you're looking for a child psychiatrist, you're going to have to be on a wait, because there's just not that many licensed providers in the state of Texas that like to deal with youth and their mental health, because it's various factors that go in with that, because a lot of symptoms they're presenting at 12 may not be what they're presenting to as 14. And so therefore they're going to have to go through a lot more medical changes, especially as their body is adjusting to whatever medication they may be taking, or the body just going through puberty. So what worked at an earlier age is not working now. So it's just a little bit more harder to deal with kids when it's coming to meeting their psychiatric needs, and then as a psychiatrist having to deal with parents, because a lot of parents don't want their kids on medication, or they want their kids to have too much medication and be numbed out and zombied out. And so that always affects their access to care as well. A lot of those don't receive treatment because they don't agree with the stigma of mental health in general. Yes, there's still a stigma regarding mental health. It is not as big of an issue as it once was. So I can champion that there has been a lot of efforts to decrease the stigma of issues with mental health, which is why another vicarious reason as to why people are receiving more treatment and more inclined to go to a therapist, because that stigma has been removed so they don't feel so odd. And for many people, going to therapy is a normal part of life. All their friends went, their mom went, their family went. Is very normal. Whereas if you grow up in a family like mine's, that it is not normal. I grew up in a traditional black family that does not necessarily believe in therapy as a profession and does not believe that I want to pay somebody to listen to my problems when I have various people around that I can easily call to be able to listen to any problems that I might have. But of course, me as a therapist, I got to put this out there because that really gets under my skin. I respect my family's feelings about it, and we don't have conversations about it. I've expressed my opinion, they respect their opinion, and it is what it is. But my opinion is that we all need to see a therapist at least once in our life. We all come across something in our life that is a little bit out of the norm or hard, or an issue that we may not necessarily feel like is affecting us that much. But everybody do need to have a good reset button, and therapy oftentimes it's just a reset button you need to restart your life, and for that life to be what you want it to be, not what situations have forced me to have. So I always say it's the difference between thriving and surviving. Do you want to thrive or do you want to survive? And for most people, in order to thrive, they need to have some mental health profession be able to service them and to provide them with those tools, so they have those tools on deck and in hand ready to use anytime they are dealing with any issues that may arise in the big sea of life. There is a serious mental health workforce shortage. I'm going to say that again. There is a serious mental health workforce shortage. In states with the lowest workforce, just lowest workforce in general, there's up to 6 times the individuals to only one mental health professional. This includes psychiatrists, psychologists, social workers, counselors, and psychiatric nurses combined. So even if everybody who has a diagnosed disorder of some sort were to seek out therapeutic services, it wouldn't be enough people to go around. It wouldn't be enough services to go around. Now, I'm going to speak from a therapist into this field. For one, it is very, very, very hard to get into this field. You have to have at least a master's degree. And in your graduate program, you cannot get more than 1C. You have to maintain your GPA in order to get that. Once you have completed school, you still have to take your licensing exam and pay the hundreds of dollars that is required for that. You get a intern license. You have to prove 3,000 hours of therapeutic services. Submit that to the board. Make sure they approve everything. Be supervised and pay someone to supervise you throughout the entire time that you're doing this, on top of paying back student loans and other debts you have incurred while you're trying to get this license. So it is very hard to get into this field, so that discourages a lot of people, or even just to stay in this field, and all the fees that you're responsible for renewing your license and being part of various organizations and CEUs, continuing education units or credits, are just very hard. So these discourage people from, even people who have started in this workforce, to maintain in it, because it has its politics, just like any other profession has their own politics. And then, of course, there's issues with mental health providers' relationships to insurance providers, because insurance providers, what a lot of people don't know is, people always say, well, my insurance pay my therapist and I only pay, a copay. Insurance will only pay a percentage of your therapist's true fee. 80%, 85%, I believe is Blue Cross Blue Shield, is the highest that you can get. So that means I can do this entire hour, and if I normally charge $150 per hour, I'm only going to get 85% of that back on a check. Even though I didn't do 85% work, I still gave you the same 100% that I would have, but this is the rate of reimbursement as far as the insurance providers. And it is what it is. Every field has their politics. But I'm going to get in my soapbox for about 2 seconds. And I promise you I want to stay there long. is therapists are not paid enough to be able to deal with the lives of other people and to be able to consistently work in psychiatric hospital stays where the work environment is way more demanding and chaotic. So people go to school longer than people who, doctors and lawyers, and we go to the same amount of school, but, they get paid way, 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 way more than what your average therapist is. And that discourages people from coming to see therapy because they may not have enough money to pay those copay options. And so places like MHMR are overbooked, have way more clients than they actually can service because of this reason that they just don't have the funding to be able to provide for a therapist. But vice versa, in just the medical community, you have all these community clinics in which people can go to that are affiliated with your county hospital so that everyone can receive their treatment they need for any medical conditions. So for me, why in that same light does not these same county hospitals have county clinics to where people can get these services, but be able to pay those therapists too? Because I understand, you're not making that much money if you're receiving that clientele, but this is still people's lives that you are trusting people to service and to help with. So if you give people enough trust to be able to take care of people's lives, you don't pay them as much money. I don't get it. I don't get it that way whatsoever. Because doctors and lawyers, they are dealing with people's livelihood every day of the week, and they get paid every day of the week to deal with that livelihood, whereas therapists, we don't get that same pay. So that being said, I'm going to hop off my soapbox before I get myself good and riled up about this topic and get myself on a whole nother tangent and stuff like that. I ain't going to do y'all like that. Not today. That may be a topic for another conversation, or just for a show one day when I just feel like I just want to vent about random stuff, which may be a good idea. But back to our topic at hand, back to the conversation of the state of mental health in America. So we said in the beginning that 1 in 5 adults have a mental health condition of some sort. So that comes out to be 18% of adults with a mental health condition. Nearly half of those people have a co-occurring substance abuse disorder. Now, when I say co-occurring, I mean this is another issue that they have at the same time they're dealing with their depression or bipolar, whatever. They're still struggling with a dependence on a substance of some sort. Substance use, of course, that does include marijuana. For you pro-weed people out there, marijuana is still a drug that can be abused and can lead to dependence. 9.6 million people experience suicidal ideations. And suicidal ideations is a fancy therapeutic term that people in my field use to say thoughts of suicide. So that means I have thought about killing myself. It does not mean that I have acted on any of those thoughts. They may just have been very fleeting thoughts like, I just want to jump out in front of this bus right now. I just want to kill myself. Those are what we call suicidal ideations. And 9.6 million people have experienced thoughts of not wanting to be here on Earth. And that's a lot to be able to deal with that. And for those clients, a lot of them don't have any services. And so they end up self-medicating themselves and end up accumulating, a substance abuse disorder as well because of the way they chose to deal with their pain, because they did not able to have enough services to be able to help that. So I discussed about in a 5-year period how those rates of youth depression has severely increased from 5.9% to 8.2% recently. And over 1.7 million youth with major depression episodes did not receive treatment. In order to give you a visual representation of what 1.6 million people look like, that's enough to fill every Major League Baseball stadium on the East Coast twice. That's how many people. And then, like I said, there being a shortage of providers for various many factors. But for example, of that shortage in Alabama, there's only one mental health professional per 1,260 people. One mental health profession per 1,260 people. That's insane. So even if all of these people, if this 1 in 5 adults that have mental disorders in Alabama were to actually seek treatment, they wouldn't even have enough therapists to be able to service those. So yes, healthcare reform is helping us. It's helping people be able to go to more healthcare providers and get better treatment, not just let me sign your paper and I meet with you twice a year type treatment, because the rates of uninsured adults with mental illness has decreased by 5% on those states that has increased medical expansion. Those same states saw greater improvement in youth coverage and had fewer uninsured adults with mental health illnesses. So these are just some of the overarching stats about our mental health in America today in 2018. And so I want to do a little bit more conversation and more expansion on the state of mental health in 2018. And of course, I do want to spend a substantial amount of time discussing the opioid crisis that we are in currently and how that affects our relationship with our mental health providers, the medical system as a whole, as well as the policing system as a whole. So that is multiple relationships that is being affected at the same time. So after a break, we will return with Relationships in Progress. And once again, I am your host, LaShonda Thomas. Welcome back to Relationships in Progress with your host, LaShonda Thomas, of Lioness Counseling, located at 5601 Bridge Street in Fort Worth, Texas, right next to the library where 820 and 30 intersects. Please call me at 817-888-8009 if you would like to book an appointment or you have any conversations about any of the materials that I am providing with you today, or just about me in general. Now, don't call me just a chit chat, because you know I got bills to pay and I don't have time to be chit chatting. But please text, because I love to text as well. 817-888-8009. So today's topic is the state of mental health in 2018, and I want to talk about our relationship with the healthcare system. Since on Relationships in Progress, we talk about all types of relationships, and now I want to talk about relationships with systematic bodies than just necessarily people-to-people relationships. Because a relationship, at the heart of the definition, is just with two parties being involved. So recently, I want to bring up the opioid epidemic because this week in particular, Congress has been in session trying to pass a bill that will be is a reaction for the opioid epidemic, in which is dubbed the Opioid Crisis Response Act of 2018. So we all know that the opioid epidemic right now is just insane on levels that it has not been. Even when they even enacted the first war on drugs way back in the gap, this is totally different than that war on drugs. And now I say it's totally different because you have the introduction of synthetic drugs, which are harder to obtain, harder to police, and harder to just get in general. So that has really changed the game of the opioid crisis and made it an epidemic. Yes, it is at epidemic proportions, in which Congress is now getting involved, in which they have to do something legally to be able to combat this, because it has gotten out of hand for many reasons, many reasons. Right now, the opioid epidemic that we're currently in is the deadliest drug overdose crisis in U.S. history. And so I'm going to give a little bit about the Opioid Crisis Response Act, just to give you some more information so you can know where they are on those and what their actual goals for this. And we'll kind of talk about if it's actually going to actually work. So the Opioid Crisis Response Act of 2018 is largely the body of a Senate Health Committee that is composed of over 70 senators, 5 committees, and countless staff that has worked together to put an end to the opioid epidemic. It is a bipartisan committee, meaning this is an act between Democrats and Republicans because this is an issue that supersedes party affiliation. And so it is coming down harder, like I said, the opioid epidemic because of synthetic drugs. And some of those synthetic opioids, that is a big one right now that we're looking for, is fentanyl. Fentanyl is a synthetic opioid that is largely produced with the drug heroin or heroin or that boy or however you refer to the drug. Realistically, most heroin that is sold on the streets today only has 2% of actual heroin in it. Most of it is fentanyl and other trash drugs. Addicts like fentanyl more than they like heroin because it is a high that is 13 to 16 times more potent than heroin. With that being more potent, that means more deadly. So it is a huge issue than what it was way back then when heroin was largely introduced after the Vietnam War via soldiers that were coming back with different addictions. Because heroin is a fast acting drug. It's not something that people would do for years and don't have any adverse reactions to it. But fentanyl is the issue because we can't be able to control it because fentanyl largely is shipped overseas. It is shipped through the mail largely from China because it is a synthetic opioid. It is manufactured to slip through the border with mask as your normal pain treatments that it does get. So this bill that they are trying to pass, I'm going to give you just some high points on that bill and just where they are. Not going to get too much into all these different points because then that stuff becomes boring and then I don't want to talk about all that boring stuff about that. So what they do from this, some of the major steps that are proposed by Senate, because once again, this is something that is in the works currently that has not been passed. They are working hard from. So they want to reauthorize funding from the Cures Act, which put about $500 million a year towards the opioid crisis and make tweaks to hopefully give states more flexibility in using the funding. They want to expand an existing program that attempts to get more first responders, such as police and firefighters and EMT, to carry and use naloxone, which is a medication that reverses opioid overdoses. If you watch any of these TV shows that are with EMTs where they respond to crisis repeatedly, that is what they normally carry to help people kind of come back to consciousness once they had an overdose. They want to increase penalties for drug manufacturers and distributors related to the overprescribing of opioids. And they want to put more money towards law enforcement programs meant to stop illegal drug trafficking. That one is dangerous because then we come across to the war on drugs and how it was enacted and how people was wrongfully convicted, and it became about race and more issues than just the drug use itself. But the overprescribing of opioids to me is the issue, is the primary issue as to how we become into an epidemic crisis. To me, I feel like even in my field, because I do get a lot of people who are addicted to various drugs, 95% of the clients have the same story. They got hurt once upon a time. They was prescribed some painkillers to deal with that pain, and they was prescribed those painkillers for an amount of years. Once that prescription wore off, they went to the streets to find something comparable to help with the pain. To me, that was already an issue because why you be prescribed painkillers for 5-6 years and you only seen this doctor 3 times? I don't understand how that part in and of itself is legal to where you can carry this prescription. Because even my allergist, in which the antihistamine that I'm prescribed, not even an opiate, it is prescribed for a calendar year, but I have to go see my allergist once a year to get checked in and then to get that prescription made out for the next year. Am I suggesting that you make out pain prescription for a whole year? No. I'm just saying be a time period, whatever it may be, and once the end of that time period, you have to go back to see your doctor and check up to make sure that you still need this and your body is still reacting the same way. So I personally believe that legally, if they're going to spend all this money towards law enforcement programs, they need to spend and come up with a unit that is solely dedicated to stopping the overprescription of pain medication. So to me, that unit should be devoted solely to go these pain management clinics, because a lot of those are dirty, and some of those pharmacists who are known to prescribe opioids to be able to check in with them and following up with those records, because I feel like that is the mode that you attack the most, because they spend all this money on drug enforcement. It's going to be some racial tactics that are involved that's going to take away from the larger mission at hand to end this opioid epidemic. So we don't want to add to the epidemic. We want to actually stop that. And then two, I feel like you need to arrest these doctors that are overprescribing medications, because a lot of times they'll opt out and just give up their license, but you still living life free while you done killed plenty of people with overprescribing that medication. And so then they also want to grant another grant program that will help healthcare practitioners obtain waivers so that they can prescribe medications that are highly effective in treating opioid addiction. But once again, we gotta be careful with this too, because to me, this makes me think about methadone. And remember how methadone back in the day was supposed to be treated, and then in essence, everybody started getting addicted to methadone. And once they couldn't afford those treatments because methadone is still a price out of pocket, they would go back to the streets and be able to take whatever drugs that they were wanting to take on that. And so, because this epidemic is tying into the mental health field, because people are having all these various mental health ailments that as a result of their substance abuse. Some people become psychotic or schizophrenic after years of hardcore drug use because of that reason. So we do have to be careful when it comes to that part of it. And so another part that I just want to talk about is, like, I kind of hinted on race about that. This heroin is one of those drugs where it probably equally affects most of races equally. I'm not sure on that, so please don't quote me on being 100% sure about the race that it is affecting. But not regardless of that fact, 72,000 people in the United States in 2017 died of drug overdoses. At least 2/3 of those drug overdoses was linked to opioids. That's the highest number of Americans who has ever died of drug overdoses in a single year, and more than were ever killed by guns, car crashes, or HIV/AIDS in a single year in the United States. So, if you don't believe this is if this is an epidemic to you, that number alone should be able to let you know that this is an epidemic crisis that we as a nation need to find other ways to be able to deal with that. Because if we don't deal with it, it's going to become worse and worse, and then it's going to be a beast of its own to where we cannot control it anymore. Now, of course, every drug, sometimes you come up with new drugs and that are overseas that are shipped to us and only affect certain small populations, and they don't get to the overlarge population, but it's still a problem nonetheless that needs to be addressed. To me, I don't see the point of putting more police dollars in it so people can patrol certain blocks more often, because you get one person off the block, the next person is going to be there. It is a self-fulfilling prophecy. It's going to always be there. I don't feel like more money than what is already set aside should be put towards the actual policing of that, because we can actually be using those money to fund more addiction treatment centers that are affordable than spending this money on law enforcement. So we can have these, just like in the hood, on every block you see a church and a liquor store. Why can't on every block we see an addiction treatment center? To where they know that support is always there, at the drop of a dime. If I need to go, I don't need to find no ride. I don't need to get no bus ticket. I don't need to call nobody. I don't need to make no appointment. I can just come in there and just walk in and make sure that I am done. And say, I put my hands up, I need treatment. Because even if you think about AA and NA meetings, a lot of times in certain areas there are no meetings, and in certain areas they are overpopulated meetings where you can look across the street and see someone in another class over around the way doing the same things. And then, of course, those meetings are always next to sketchy neighborhoods where they can acquire drugs, or liquor store where they can go buy alcohol, which I never got in the first place. But hey, that's neither here nor there. But we guys, we have to be able to push this as an epidemic that is killing 115 people per day. We need to be able to share the truth, getting facts on these opioids. Ask your doctor questions. Don't allow just a doctor just to prescribe you anything and everything. Like, what? Why are they prescribing this? Me personally, I always have conversations with my doctors because they love to give me Tramadol. Like, I don't need this level of severity. Like, I don't. And most time I have plenty of prescriptions that sit around my house that don't get filled. And that's your choice. You don't have to fill a prescription that a doctor gives you. If Tylenol or Advil or whatever you're taking over the counter works for you, then continue to take those things. Don't use hardcore drugs if you don't need them. And then sometimes you might have to notice yourself, if you have an addictive personality and you know you prescribe 2 of them to take that day and you've gotten to the point you're taking 4 a day, then you know you got a problem already. You need to stop that before it becomes an issue, before you become part of this epidemic. So a lot of it's self-awareness and being educated on what is going on in our world, what is going on with this opioid crisis. You know, how can you help? How can you get out the word? You know, learning what opioids are. Because a lot of times people don't even know what an opioid is, and they campaigning this and campaigning that, and you don't even know what you're talking about. Like, do you even know what opioids are? So since I'm saying this, let me go ahead and give you the definition. Opioids is a term for drugs that bind to opioid receptors in the body. They include everything from heroin to fentanyl to prescription pills like oxycodone, hydrocodone, codeine, and morphine. It's a huge bucket since it covers illegal substances as well as drugs prescribed by doctors, like I said, which is the big part of the issue. Regular use of opioid drugs, even as prescribed by doctors, that can still lead to dependence by you having that much of an opioid. So, to put that in perspective, I think about this, 115 deaths per day about any opioid. And so being careful. When your doctor's prescribing that, read the little pamphlet that come with the prescription. When you go get it at Walgreens or Kroger or whatever your local pharmacy is, read the pamphlet. What are the side effects? Or do I need to have this? Evaluate yourself before you're taking these pain medications. Are you actually in pain? Or are you just doing it because it's your 4 hours and you're supposed to take your medicine every 4 hours? No. Only utilize these things if you know you need to use them. If you don't feel like you need to utilize that heavy use of a painkiller, ask for something that's less severe. I'll ask for ibuprofen 800 all the time when I go to the doctor. I don't want no codeine, Tylenol 3. I don't want those type of things because those things are highly addictive. And so, guys, I just wanted to make sure that we are all clear about this opioid epidemic. I know this is a little bit different than how I normally carry the show, but it's still, like I said, a relationship that we have with our overall health system, our government system as well. We need to advocate for more controls of prescription drug usage. And like I said, talk to your doctors about this. Ask them, what are their practices about prescribing medication? Put them on the fence. Ask them some questions. Let them show you what they've been paying all this money for their education for. Let them show you why they get paid while the big dollars when they only see you for 5 minutes at a time. Make them work for this copay. Don't let them just see you for 2 seconds, sign the paperwork, and let you be on your way. Make them work for these type of things. Ask these questions, guys. We need to know about what's going on around us, what we could potentially be exposed to, because this opioid crisis is not like the original war on drugs when you go on the street crawling and see this. This is everywhere. People popping pills all the time. Everywhere. Not just parties, not just kids, not just young adults. It's old people and the like too. So, once again, let me close out, guys, today's topic of the state of mental health in 2018. I appreciated you for listening to me on my soapbox as I discuss some things that I just don't necessarily agree with about our overarching health system or government system in general. So thank you so much for listening and for tuning in. Please make sure that you catch me on all of my social media outlets if you need to interact with me or hear me rant about other issues. You can catch me on Twitter, Facebook, as well as Instagram. All of those, just Google Ernest Counseling. My page will immediately come up. Sometimes I post videos of myself. Sometimes I may post a quote that may come to my mind, or something I may think of that may just sound so good that I need to make sure that I put that somewhere in the earth because it came to me for a good reason. So make sure that you reach out to me, follow me, and if you want to book me for an appointment for a therapeutic session, the first session is always going to be free to give you a little bit more of an in-depth evaluation as if we're going to be able to work well with each other, because I want to reduce the stigma that we have with mental health even more. So even if you're not sure if you need to see a therapist, just come out. The first session is always free. So once again, you can reach me at 817-888-8009 or at www.lionesscounseling.com or at lionesscounseling@gmail.com if you have any information or just suggestions or things you would like me to talk about, or if you just want to just have an interesting conversation with me in general. Please hit me up. It's been real, y'all, but I'm real tired. So once again, I'm signing out. LaShonda Thomas, Relationships in Progress. Thanks.